Hi again, everybody. This is Edgar, Executive Director at Workplace Fairness, and today I'm joined by Nina Stoller, who is a Policy Coordinator at Autistic Self Advocacy Network. And today, Nina and I will be talking about Medicaid and its intersection with workplace issues. And as you've been following the news, there's been a lot of talk about potential cuts to Medicaid and how that might impact people's ability to stay employed or to find work. And Nina is going to help us talk through the issues around Medicaid, why it's important for people who want to be employed, particularly those that are disabled or older, and some of the other policy issues that we want to make sure people understand as they're following the news and can further advocate for themselves if this is a very important topic to them. So, Nina, first question for you is, how does Medicaid support the ability of disabled individuals to remain employed, and what impact could Medicaid cuts have on their employment prospects?
Thank you for that question. I think it's important to first do some level setting. Medicaid is a major source of health coverage for people with disabilities, and Medicaid provides the type of services that help disabled people work in the first place. Medicaid cuts will restrict 15 million disabled people enrolled in Medicaid from attaining the services they need to be gainfully employed. Medicaid's coverage, in particular of home and community based services, HCBS for short, enables people with disabilities to receive the types of services necessary to improve the requisite skills for finding and keeping competitive integrated employment. So, HCBS services include job coaches, employment support staff, and also life saving habilitation support for activities of daily living, um, like eating, dressing, transportation, bathing. Um, Programs that states implement optionally, like HCBS, will face especially severe cuts, and people may lose hours of support or lose their services altogether. And again, if you can't get those services, you can't do your job.
Right.
So, cuts to Medicaid will have downstream harms to disabled people's workforce readiness, workforce participation, especially in community based jobs, and downstream effects on the amount of money that disabled people can contribute to the economy.
Yeah, thank you for that level setting and that explanation. And you mentioned that people that are on Medicaid are already employed. So nearly two-thirds of Medicaid covered adults under 65 are already working. So how would the cuts to Medicaid services affect their ability to stay employed? If you can maybe further extrapolate on that.
Yeah, absolutely. So, as I said, Medicaid helps people with disabilities stay in the workforce, but Medicaid also helps people without disabilities stay in the workforce. People in better health work more than people in fair health. Um, and so Medicaid is necessary to improve people's health overall. And Medicaid cuts will impair many enrollees to the point of unemployment. So, to your question, Medicaid cuts will mean lower enrollment, Medicaid cuts will lead to lower enrollment in things like Medicaid buy-in programs. Medicaid buy-in programs allow people to maintain their Medicaid coverage while working. Medicaid buy-in programs help incentivize more people to work. Uh, and specifically, they allow people with disabilities to not have to choose between their jobs and the care and services they need to maintain their health. So Medicaid cuts will hurt these programs, and it will lead to fewer Medicaid covered adults in the workforce.
Right.
Specifically, cuts to Medicaid on their whole undermine the health of the country's workforce. I'll give an example of Medicaid in schools. Just 1 year of Medicaid coverage during childhood leads to higher earnings and better productivity as an adult,
Hmm.
boosting the nation's economy.
Hmm.
Schools are also eligible to be reimbursed for certain qualifying expenses in the provision of medically necessary services to Medicaid eligible students in schools. So, all in all, Medicaid enables enrollees, both those with and without disabilities, to lead independent, self determined lives and keep their jobs.
Thank you for that. And just to further clarify, so essentially the way most people listening to this recording should think about Medicaid is if you have a regular job where you have the standard health insurance that allows you to stay healthy and be functioning and a functioning employee. And that's something that employers do because they want to know that not only they're competitive in the market, but that the employees can take care of themselves when they get sick or if a loved one gets sick. So Medicaid essentially has that same function for those that are disabled or low-wage workers. Is that a fair thing to say?
Yeah, that's correct.
Okay. And there are concerns that work requirements for Medicaid enrollees could hurt employment rather than increase it. Can you explain why these requirements don't lead to higher employment rates?
Yeah, absolutely. And as you said, work requirements do not increase employment rates. They only end coverage. And there's a lot of reasons why work requirements do not increase employment rates. Um, and the first is that it's based on the false premise that Medicaid enrollees aren't already working. They actually are. The majority of working age adults on Medicaid are already working. So Medicaid work requirements force people to choose between keeping their health care and keeping their job. So one example of the failures of Medicaid work requirements is Arkansas. Arkansas had a Medicaid work requirement pilot in 2018, and it took coverage away from 18,000 people,
Hmm.
but it did not increase the employment rate. What's more, work requirements are costly to implement and would increase state spending overwhelmingly on wasteful administration and consulting costs instead of people's health. Georgia is a good example of this.
Hmm.
So, all in all, the bureaucratic red tape and the unnecessary reporting requirements created by work requirements limit people's ability to keep their health care, particularly if they work multiple jobs or experience language and accessibility barriers. The impacts of work requirements writ large are pretty devastating. 36 million people are at risk of losing their health coverage taken away by Medicaid work requirements. These work requirements harm people already struggling to provide for themselves and their family, such as parents, caregivers, and workers in unpredictable jobs. And work requirements will most hurt rural Americans.
Hmm.
Rural Americans already face employment barriers due to inadequate transportation, childcare, job care training. So the Medicaid work requirements also hurt part-time, seasonal, and shift workers who don't have control over their hours, and they will lose coverage because of work requirements. And you might hear in the news, well, you can carve out people with disabilities. You can make people with disabilities exempt from work requirements. That doesn't work because disabled people and their caregivers are represented in every eligibility pathway. Work requirements harm people with disabilities because it results in fewer disabled people getting the basic health care they need to work, which I mentioned earlier.
Right.
More than a tenth of Medicaid enrollees aren't working because they're family caregivers, caring for someone in their family.
Hmm.
And Medicaid cuts will mean people will have to leave the workforce to be unpaid care workers for their family. Or said another way, many people who could be working if their family members got Medicaid coverage for professional caregivers won't be working because they'll have to leave their workforce.
Right. Right. How does Medicaid funding create jobs within the healthcare system, and how could Medicaid cuts lead to staffing shortages and fewer job opportunities, especially in nursing homes and hospitals?
Yeah, so Medicaid funding for healthcare workers and direct support professionals creates more jobs and helps the economy. So any Medicaid cuts would hurt the funding for healthcare workers and direct support professionals. Um, Specifically, Medicaid cuts would mean increased staffing shortages and fewer jobs at nursing homes and hospitals. And that's because Medicaid covers 40% of all births in this country,
Hmm.
and Medicaid helps pay for the cost of almost two-thirds of nursing home residents. Medicaid cuts will force more professional caregivers out of the field, which will result in even longer wait lists for seniors and disabled individuals in need of care. One of the additional ways that Medicaid supports both the health of communities as well as the jobs within them is through a program called Rural Health Clinics through the Medicaid's coverage of rural health clinics and rural hospitals. So Medicaid pays a significant chunk of the salaries of physicians, nurse practitioners, physicians assistants in these rural health clinics, which make up 2/3 of small rural
Hmm.
hospitals. So again, Medicaid cuts would really hurt the healthcare workforce. Not to mention, there's the Medicaid and Children's Health Insurance Program called CHIP. CHIP covers close to half of children in rural areas. So to summarize, Medicaid is a lifeline for the employment at rural hospitals that provide critical access to both care and job opportunities in the healthcare system in rural communities. Um, Medicaid cuts would almost certainly mean staff layoffs at rural health clinics, which would further burden rural hospitals that are facing closures, financial challenges, especially in states that haven't expanded Medicaid.
Wow, I didn't realize such. I didn't realize the extent to which Medicaid has these inroads across the country. I knew a little bit of it, but the rural hospital point there's not something that occurred to me. So thanks for sharing that. And so, lastly, Nina, where can workers stay up to date on this information, and do you have any final recommendations for workers who may be impacted?
Absolutely. Luckily, there are dozens upon dozens of organizations that are fighting to protect Medicaid right now, and all of them are putting out some great information. I don't have an exhaustive list, but some of the places you can stay up to date on what's happening, my organization, the Autistic Self Advocacy Network, along with the Service Employees International Union, Caring Across Generations, Families USA, Community Catalyst, Justice in Aging, and the National Health Law Program, sometimes called NHELP. In terms of next steps, there are a few calls to action for people who are concerned about Medicaid cuts and the impact on the workforce. The first and foremost is contact your legislator, both senators and representatives, and demand no cuts to Medicaid. You can do that either by requesting a virtual or in person meeting with your legislator staff, which is the best option, these meetings, or by sending an email and making a phone call. So, the Autistic Self Advocacy Network actually put out a plain language toolkit for Medicaid defense, which gives people with disabilities, particularly those with intellectual and developmental disabilities, the information they need to contact their legislators. For those who don't know, plain language is written at the 5th to 8th grade reading level, and it's a cognitive accessibility tool that intends to make the writing accessible to everyone. Here at ASAN, we really believe that people with intellectual disabilities deserve access to the information that their lives depend on. And Edgar can send out the action alert
Yeah.
that I'm referencing the link. And if you're a self advocate who would like more support contacting your legislator, you can email info@autisticadvocacy.org. And in these meetings with your legislator, it would always be good to bring up the numbers in your community. I can send along, or rather, Edgar can pass along some sources of data. Lastly, I just kind of want to highlight some final data
Yeah.
points. Everything I mentioned in this interview can be found in the two-pager from the Collaboration to Promote Self-Determination, CPSD. Also, sorry, I'm just like throwing everything in at
No,
this
please
point.
do. Please do.
More than 75% of Americans have favorable views of Medicaid. Importantly, over 9 out of 10 adults across party lines say Medicaid is important to their local community. And the majority, again, across party lines, want Congress to either maintain or increase funding for Medicaid.
Awesome. Well, Nina, thank you so much for that wealth of information. And we will share the resources that Nina had mentioned in the post notes to this recording. But in the meantime, if you have any other questions or need updates on employment law, you can go to our website at workplacefairness.org. And Nina, thank you again so much for being with us today.
My pleasure. Thank you for having me.
Take care, everybody.